In this edition of Talking Points, I am looking at how Medicaid cuts could affect Minnesota. The Trump administration wants to re-up the Trump tax cuts of 2017, which are set to expire later this year. But in order to do that, Congress would have to cut Medicaid in every state. In Minnesota, 1.3 million Minnesotans rely on Medicaid for their health care. 40% of Minnesota kids depend on Medicaid. And when it comes to nursing homes, 55% of nursing home residents rely on Medicaid. The proposed cut to Medicaid in Minnesota is $1.5 billion per year. For answers, I'm talking to John Connolly, who is the Minnesota State Director of Medicaid Programs. Mr. Connolly, thank you so much for joining us.
It's very good to be here. Thanks for having me.
All right. Where would the $1.5 billion dollars come from if there was this cut? Is there any kind of reserve available?
So the short answer is no. We are facing a structural budget deficit currently as we look forward here in Minnesota. So the state would not have capacity to absorb such a budget cut. It would likely force us to consider some really impossible choices with respect to eligibility, or in other words, who's eligible and can enroll in the program, who qualifies to enroll, the types of benefits and services that we cover. So would we have to reconsider certain things that we pay for within the Medicaid program? And then third, what we actually pay providers for delivering services, which is an important element of providing access to care.
All right. And there is that reimbursement rate. They're talking about changing the reimbursement rate from 90 to 50%. What does that do?
So,
okay, I'm sorry, I think it's even less than that. Isn't it 90 to further down than that?
Well, that is a possibility. There are two different things being proposed. One is basically decreasing the matching rate, the federal matching rate, from 90%, so 90 cents on the dollar for services for people who newly received coverage under the Affordable Care Act, so largely adults without children at home. We're newly expanded in terms of coverage under the Affordable Care Act. And currently they receive, or the state receives, 90% matching funds from the federal government for Medicaid coverage for that group. One proposal is to reduce the matching rate from 90% to 50%. Actually, Minnesota's rate is about 51% this year. It does vary somewhat depending on state income relative to other states. And then a separate proposal actually would move the floor from 50% to 40%. So it could actually go from 90% to even lower, as you suggest.
All right. And is Medicaid, the need for Medicaid, the dollars for Medicaid, is that growing every year in Minnesota, or is this pretty much staying stable?
It is growing, and in general, across all states, that does grow. It is part of healthcare costs continuously increasing along with inflation, and that is just a general trend that we see across the country. It is not unique to Medicaid or Minnesota's Medicaid program.
Okay. And at the beginning, you described some really drastic adjustments that would have to be made if these cuts did happen. Are there any kind of contingency plans? I mean, are you trying to work at a plan B, or I mean, how are you trying to deal with that? Because it's such a big number.
Yeah, so I think the first thing we're doing in Minnesota is trying to communicate the impact and the reach of the program. So again, who's covered by Medicaid currently? Children, older adults, people with disabilities in our state, in addition to the providers that rely on this program and the different areas of the state that rely on this program. It plays a huge role in rural Minnesota. Many counties have high proportions of their county populations enrolled in the program. So just helping folks understand what's really at risk here. In addition, then communicating what it means in people's lives and telling the stories of people in our programs who benefit from our programs and services. And then I think, to answer your question, the third thing then is really looking at, if something were to happen in terms of a federal Medicaid cut, then what difficult choices will we have to make? So, and that would include things that I described earlier related to making cuts to our program here in Minnesota, or looking across the state budget at other services or programs we might have to cut.
How drastic would that $1.5 billion per year, at least at minimum, be?
That would be a drastic and deep cut to services, certainly within the Medicaid program. and again, would present very tough choices when we have a federal Medicaid contribution or federal Medicaid funding of roughly $10 billion a year. So that is a very considerable cut that we within the state would have a very difficult time absorbing.
Well, one of the things that President Trump has directed Congress to do is to cut this $800 billion and also keep the tax cuts he enacted in 2017. But the problem is that can't be done without cutting programs, these entitlement programs like Medicaid or Medicare or Social Security. Is there anything that you can do at the state level to try and juggle with that, or is it just too big?
So again, it really depends on what Congress decides to include in a reconciliation package. The $880 billion figure is the House target in their budget resolution. And the CBO tells us that that will come mostly from Medicaid. It must, because of the scope of what the committee that's charged with reaching that figure is responsible for. So it looks likely if that Medicaid, or rather if that target holds, that Medicaid will be really a high priority in terms of funding reductions, which is deeply concerning to us.
So you're seeing the cuts coming from potentially Medicaid first, not Social Security or Medicare.
Well, we don't know at this point. So there's a lot of uncertainty with regard to what eventually will make it into a package, but certainly a lot of what's being discussed and what federal officials are telling us either in Congress or in the administration is that those other programs would not be prioritized, but instead Medicaid would be more likely the source of savings.
How nimble are you in terms of trying to make an adjustment? I mean, this is such an enormous adjustment. I mean, I would think it would take you quite some time to try and adjust. I mean, if this thing is passed suddenly or even within a year's notice, is that enough time for you to try and figure something out? And not just you, but obviously the legislature and the governor.
Right. This is something all states will have to grapple with if there is a considerable cut to their Medicaid programs or federal Medicaid financing for their programs. And it will be a difficult exercise, one that we want to do thoughtfully and with intention, understanding that this will have very serious impacts on people's lives, program members, like I said, children, older adults, people with disabilities, people in nursing homes, for example. And so it would take some time for us to implement these changes or to consider where in the state budget we would have to make adjustments. And it will depend, of course, on the implementation timeline that is spelled out by Congress. So we won't know how long we'll have until something passes with respect to implementing changes. But certainly we would want to have enough time to do this thoughtfully and carefully.
Are there misconceptions about what Medicaid actually pays for and what it's involved in as opposed to the reality?
I think that's a really good question, actually. So many folks may think that because Medicare provides health coverage for older adults, that it is the primary source of coverage for long-term care or long-term services and supports like nursing home care or home health. But in fact, Medicaid is the largest payer or largest source of coverage for those services. And so I think that's something we like to highlight. For example, Medicaid also pays for roughly 1 in 3 births in Minnesota. A lot of folks may not know that. And as you said in the introduction to this segment, Medicaid also covers 40% of kids in Minnesota in terms of their source of health insurance. And that figure is higher for a lot of counties in greater Minnesota, rural parts of the state.
How about the issue of fraud? Because often you hear the president and others talking about the problem with fraud in Medicaid. And certainly we've had problems here. Everybody knows that. But there have been consistently investigations that have involved millions and millions of dollars here in Minnesota of Medicaid fraud.
I think that's a very good question. And certainly here in Minnesota, we are trying to improve what we do to prevent, detect, and enforce against bad actors who commit fraud. The governor's budget package reflects that by making investments in things like AI, staffing capacity, our investigatory authority, things of that nature to do more and to respond to the new and innovative ways that bad actors are committing fraud. So we certainly see that as a continuous improvement effort for us here in Minnesota. I think the important thing to note, though, that the cuts that are being highlighted at the federal level are much larger than any scale of fraud that we would see in the Medicaid program. So those dollars that they are highlighting as a savings target, those far exceed the rate of fraud that we would be able to go after in the program. Those really represent cuts to services for people.
Okay. And just really quickly, and I hear your point about the fact that the fraud is much smaller than what these actual cuts would entail, but why do you think it is that people are so often able to commit fraud when it comes to Medicaid payments?
So I think that folks may, I think they may find different ways of trying to falsify a record or to try to make a dollar in a way that may go undetected. And I think in the state, our continuous effort, of course, is to understand those schemes, understand how fraudsters think about the programs, and to develop, again, screening practices when we enroll providers, enhanced ability to investigate fraud, to use AI to look at our claims data to understand unusual billing trends or practices. And so I think that there are creative bad actors out there always trying to make a buck by committing fraud against the Minnesota taxpayer, and we continue to try to respond to that and do better in terms of how we both detect it and also enforce against it.
And you're absolutely right. Over the legislature quite a bit, and you're hearing constantly proposals that I think are expected to pass, giving the Attorney General more investigators, more funding for AI to detect these kinds of things. Thank you so much, John Connolly, the State Director of Medicaid. We really appreciate your time. That does it for this edition of Talking Points. Please email me with comments and suggestions at esme@cbs.com. Thank you so much for watching. I'm Esme Murphy, WCCO News.